Mr. Chairman, I rise in support of the Elijah Cummings Lower Drug Costs Now Act, a bill that would take power wielded and weaponized by massive drug companies and put it back in the hands of the American people. It is beyond unacceptable that families in my district and around the country are price gouged at the pharmacy counter and forced to make the impossible decision to either pay for their medication or put food on their tables. H.R. 3 will save my constituents in Connecticut's 5th suffering from diseases like diabetes, asthma, and arthritis, hundreds, even thousands of dollars per year. But perhaps the thing I am most proud of in H.R. 3 is that it includes a bill that I sponsored, the Supporting Trauma-Informed Education Practices Act. This bill will put drug companies who share responsibility for the opioid crisis on the hook for part of the solution. My bill would direct $100 million of the savings from drug pricing negotiations to grants that would improve trauma support services and mental health care for children in schools. As a member of Congress who has spent a career in the classroom, I have seen the painful reality of too many schools having too few counselors and psychologists to tackle the complex needs of students suffering from abuse, neglect, and trauma. We need to commit to investing and implementing ongoing supports and wraparound services for every student that is affected, for every student that has faced loss or loss. Drug companies are prioritizing profits over human lives in their cruel business calculus. Communities like Waterbury, Litchfield, and New Britain in my district desperately need help to fight this opioid crisis, which mirrors the crisis that consumers are currently facing with rising drug costs. I am proud that this bill also includes legislation I co-sponsored that would lower drug costs for some of the most vulnerable members of the population. A bill that would save older adults and with limited incomes money and improve access to their needed medications. Mr. Chairman, my constituents cannot wait for change. Patients in rural communities cannot wait for change. The 22,000 Connecticut residents diagnosed with cancer each year cannot wait for change. The student in Meriden who has suffered as a victim of the opioid crisis cannot wait for change. I urge my colleagues on both sides of the aisle to recognize that our constituents need us. I urge my colleagues to vote in support of H.R. 3.